Dr. Sene, the registrar in this general medical ward. I am the doctor who is attending Mrs. Silva currently.
Yes.
And I heard you are one of her family members.
I'm a daughter.
Yes. May I know your good name, please?
Shani.
Yes, Mrs. Shani, are you employed somewhere?
Yes, I am. But actually, I'm very angry and annoyed right now. And I really want to know what's happening with my mother.
Okay. Let me ask, is this setting comfortable for you to
Yes.
have this conversation?
It's
And
quite
is it all right if I speak in English?
Yes.
And it's quite all right if you need someone to accompany you in this conversation, a friend or a relative maybe?
That's okay. I just need to talk to you and find out what's wrong with my mother because I hear that something has been done with her, but I'm really angry and I just want to know what's happening with my mom.
Yes, Mrs. Shani, I can totally understand your situation. First of all, let me ask, did Mrs. Silva has any other illnesses apart from this current situation?
She's been having pressure and she's been taking her medication and she has not had any problems with the pressure. Of course, she's been taking her pressure tablets and aspirin. And she's been faithful to her, she's been prayerfully going for her clinics and she's not had a problem before. And just last month, I took her to the doctors and then she said she had a dizzy, she was feeling dizzy.
Okay.
But, you all ignored her completely.
Okay.
And just said that she has an ear imbalance.
Okay, let me get into the problem. Has she been all right at home before this incident? Like, has she been performing his day-to-day work?
Yes, she's a very active person. She's been doing her usual thing. Until like last month when she said that she was having this dizziness and I took her to the doctors. They said, oh, nothing, don't worry, it's just a ear imbalance. And they did nothing about it except give her a few medication. And now she's facing this situation.
Okay. And just to recollect the thoughts, can you brief me the symptoms that she has been experiencing for the last couple of days?
No, just yesterday, and like she was having severe headache and she was vomiting. And next thing I know is like, she was really bad and I had to admit her into hospital. I had to rush her into hospital. And yeah, and I feel she's like,
Yes, so that she has had this headache and vomiting during past couple of days, which has brought
just
her to
yesterday.
hospital.
Yes.
Yes. Mrs. Shani, it's perfectly all right. I can understand your situation currently. You can take some time off just
I need to know what's happening with my
ease
mother.
your
Doctor.
thoughts.
Yeah, can you tell me what's happening with my mother?
Yes, Mrs. Shani, I have seen your mother and we have performed some tests on her and we have performed some imaging. As you must be aware, a CT scan that we have done for her to see what has gone wrong with her. So I'm afraid I don't have good news to deliver to you. This CT scan, this test has revealed that there is a growth inside your mother's brain.
How can that happen, doctor? Why wasn't it detected before?
It could have been a symptom with this condition, Mrs. Shani, but usually the patients who are having these kind of growths in their brain, they usually have some alarming symptoms like maybe severe headache in the morning hours or severe vomiting or maybe some visual problems.
Yeah, but when she was told about it last month, when we went to the doctors and we said that she has this dizzy spells, why didn't you do this, test or whatever?
Yes, Mrs. Shani, I can understand your anger, and at the same time, as I have mentioned you, there are certain symptoms that patients may be having with these condition. So this dizziness that your mother has had may have been linked to this condition, but at that point, I think the likelihood of having this growth in your mother's brain must have been very low down, they have not considered as she was not that symptomatic, I guess. But still, I would like to go through her clinic records and see whether what symptoms she has reported at that point, and see whether there has been a mismanagement at that point, and discuss with my consultant, and also to discuss with that particular doctor.
It's not acceptable, doctor, because she is now in a terrible situation. She doesn't even, recognize me. She doesn't recognize me, and I feel she's deteriorating. And it's hard to watch her. I mean, I can't understand if she's been coming week after week, month after month, all of you, and seeing you all and taking her medication. How you'll miss this? It's just unacceptable. How can a tumor just appear just like that?
I can totally understand your anger, Mrs. Shani, but there are certain growths in brain which may appear out of blue all of a sudden, which may have been there but enlarging day by day, so appear sometimes out of blue. So those episodes, those dizziness episodes might have been linked to this situation or might not have been. So we can go back to your mother's clinic records and see whether has there been any mismanagement at that point. And
exactly, because if you all had done that, if you all had even asked, requested, because we can afford to do my mother is my precious, something precious to me, and if you all had requested for us to do even a CT scan at that time when she said she was dizzy, we could have done it. Doesn't necessarily have to be through the government. I could have done it privately. So why wasn't it requested?
As I have mentioned, Mrs. Shani, I think the likelihood of her brain growth at that point must have been very low with the symptoms she had. But I can't exactly say. I have
so
to
you
go
mean to
through
say
your
in 1
clinical
month it has
symptoms.
just grown so big, or whatever it is?
I have to say sometimes it appears like that, enlarging day by day. And also I have to brief your mother's condition to you, current condition. Is that all right for me to talk?
Yes, of course.
Currently, your mother is having very low conscious levels.
Yes, I know. She doesn't even recognize me, and that's what's breaking my heart to watch her like that.
Okay. Has anyone told anything about this to you, like the condition that she is having currently?
No, because when I go and see her, I can see that she's not doing well and that she doesn't recognize me.
Okay. Can I get some tissues for
It's
you?
okay.
Take a moment, ease your thoughts. I know it comes as a huge shock for you, a devastating news. I can totally understand your anger and the sadness.
So what's going on with my mother, doctor? What can I do for her? What can can we do some surgery to remove the tumor that she's having?
Yes, let's see. As you said, she has had only high blood pressures
Yes.
previously,
Yes.
and she has been very well, actively engaged in her day-to-day activities. So, in the current situation, as I mentioned, this growth in the brain has enlarged so that there's a bleeding inside into the growth.
Now you're telling me she is bleeding?
Bleeding in the sense, as I am to simplify it, like if the growth is getting enlarged day by day, as a complication, bleeding can happen into that growth.
How did you figure out that?
Actually, we have done some imaging, as I have mentioned, CT scan.
So why
on
has
your
it
mother.
gone? Why have you permitted it to go that far?
Sometimes things proceed very quickly. The symptoms may happen all of a sudden out of blue. So,
Do you know, doctor, that you all can be sued if this happened? My brother was talking to me and he said, you all can be sued because he lives in Australia. And he said, you all can be sued for what you all have done to my mother because she's everything. And you all have blown this into this situation.
I can totally understand your anger, Mrs. Shani. At the same time, you have the whole right to proceed like that. At the same time, I would like to brief your mother's condition. So she's having a low conscious level, like reduced conscious level. Currently, she's maintaining her breathing, and we are keep on looking at her status very frequently, like heart rate and everything. We are looking after her. At the same time, we have started some medications to stop the bleeding, at the same time to reduce the swelling of the brain. So I think she might respond to that. At the same time,
What is causing the bleeding, doctor?
bleeding, of course, as I have mentioned, it may appear as a complication, like as a sequelae.
So is it because
to
of the
this
aspirin
brain
she's
growth.
been taking? Is it because of the aspirin?
Has she been taking
Of
aspirin?
course, she was asked to take aspirin as well. I don't know, that was what the doctor requested.
Okay, it might have been attributed to the current condition, but I cannot say that is aspirin per se. So we may have to stop aspirin, and we have started medications as to stop the bleeding and several other medications. At the same time, we would like to contact and get opinion from the expertise neurosurgeons who are doing surgery on brain, as whether the patient can undergo any surgery in view of recovery. So I would like to arrange a meeting with my consultant, at the same time neurosurgeon, immediately to decide on patient's management.
So will you all do some, once the bleeding stops, will you all do an operation to remove the tumor? Because
That of course we have to take the opinion from the expertise in the field, like the neurosurgeon.
so, but there is no time, doctor. If it happens so fast within a month, if this has got so bad in such a long time, why are you waiting for so long?
No, we are not waiting. Actually, we have already arranged a multidisciplinary management team. Like we have taken opinion and gathered other teams, like the surgeons who are operating on brain and the neurologists and our consultant.
Okay, so you're going to do a surgery then, and I should ask my brother, because my brother lives abroad, so I should ask him to come down and be here as well, because if she's going to undergo surgery, I need him to be here.
Yes, Mrs. Shani, as I have mentioned, I'm not an expertise to say whether she needs surgery or whether she should undergo surgery. So I have to take opinion from my consultant, at the same time surgeons who are operating on the brain. So after the collaborative decision only we can say whether she's undergoing surgery.
So you are not sure whether she's going to undergo surgery either?
Hopefully.
Should I take her to a private hospital then, if that is your answer?
At this point, Mrs. Shani, I cannot assure whether she would undergo surgery, because it all depends on the opinion of the expertise in the field, like neurosurgeon. So, considering her previous illnesses and the functional status,
Only
she
thing
has
she-
been all right. So,
Yeah. Because the only thing she's had was this pressure, and then 1 month ago, and you all are telling me all of this, which is not acceptable, because if you can't do it, tell me, I will just take her privately and we get it done privately.
you have the total right to do like that, Mrs. Shani, but currently your mother is not doing well. Her conscious level is very much reduced. So, if you are to take her to private hospital, I would have to discuss with my consultant and let you know the decision.
So what's the solution then?
So currently we are arranging a meeting as soon as possible with the neurosurgeons to take opinion regarding the surgery. At the same time, we have started medications as I have told you. Thank you.
You have a week to think. Are you ready?
Yes, madam.
Right. Was it difficult?
Kind of, madam.
What do you think that what is the audience think about. Anyway, I'll finish with the candidate first. So, did the encounter go all right for you, or did you find it difficult?
It was a difficult scenario, madam. She was very angry as her mother has been experiencing some symptoms at 1 month back, but it was apparently not taken into much of a consideration. So she has not undergone any imaging at that point. So she was really angry about
So
that.
why was the daughter very angry? Why, in your opinion, why was the daughter very angry?
Actually, this incident is a huge shock for her. It's a devastating incident. So she's in the grief reaction. So she's like trying to find out some fault at some place and like she's just experiencing her grief. At the same time, there could have been some mismanagement at some point. So
Do you think that there had been a mismanagement going on as well, which made the daughter angry?
actually, madam, as I have told, she didn't have any much alarming symptoms as for brain tumor. So probably doctors wouldn't have thought of a brain tumor at that point.
So the symptoms were not significant enough to suspect a brain tumor.
I guess so,
Right.
madam, not for undergoing imaging.
Okay. Any other reason that the patient is she only angry, or any other emotions that she displayed to you?
She is actually sad, very sad, madam.
Why do you
said
think
that,
she's sad? Why do you think that she's sad?
like mother has been quite all right despite she's had high blood pressure which was under control. So it must be very shocking for her to see like this, madam.
Right. So, in your opinion, is there a medical kind of a misdiagnosis also? Do you think that there's a misdiagnosis going on?
In my opinion, madam, as I have mentioned, since it was a very low likelihood of brain tumor at that point, I don't really think there
You
had
really
been a
don't think it
mismanagement.
is so.
Still,
Right. So, is it kind of delayed diagnosis?
kind of, madam.
So, do you think if the diagnosis was made kind of earlier, would it change the patient's prognosis?
If it was diagnosed earlier, madam, the patient, considering her functional status, like she has been quite functioning well despite having high blood pressure, so there might have been a possibility that she had undergone a surgery, but I'm quite not sure, madam.
You are not sure. What makes you not sure? What are the things that are which might tell that surgery will not be a good idea?
Like age and the hypertension, and now that she has developed a bleeding into tumors, that shows that the tumor has been a very large tumor, which may have been inoperable at that point. So, but
If she had asked whether her brother should visit back, her brother lives abroad, visit to see her mother, what would your answer be like? Should you ask the brother to visit her or not?
I think it would be better, madam, if the brothers would visit, like as the outlook of this current situation, the patient is not doing well. So I actually, of course, would advise to get the brother.
And she was asking to do the maximum for her mother. And do you think, what do you think in your opinion maximum care would be like?
First, I would take the opinion from the neurosurgeon, as I have mentioned. If they are not going to operate, madam, I would have to discuss with my consultant in terms of deciding whether the patient needs intubation in setting of deterioration, madam. So, given the age, comorbidities, and the poor outcome.
Okay. Right. So we are out of time now, so we'll finish. What does the audience think about the encounter? Was it a very easy surrogate? It's not an easy surrogate. it's very difficult to negotiate that surrogate, isn't it? And communication skill is different from the history-taking station. Either you have a very angry patient or a sad patient or a tearful, confused. So the same surrogate acted in two stations, but entirely differently. Right? So that is a communication skill. So let me show you a few things that Tushar, can you just move the slide? So what is assessed in a communication skill? If you are very good, it will be over 70, and if you are very bad, it will be less than 30, right? And then